for very much longer. In some ways, brilliant politician, at arguing with the Treasury about how much money things, but in other ways, an absolute failure, and a failure to create the right culture around the NHS. So we've had to wait for a global, once in a century global pandemic to come along to realize that the health and well-being of staff is absolutely paramount to how you deliver a service. I mean, that stuff is absolutely nuts. Charlie Klaber, age 10, our youngest, he's worked that stuff out as a 10-year-old. And all of you guys do. And I think part of the stuff that we set up with the school and the piece around working on culture and on how we think about looking after each other as a team and developing and stretching ourselves as a team is right at the heart of it. So there's a real pivot here. And the London School of Paediatrics, the trainee committee, is all about leadership. When we set it up, quite a long time ago, Nisha, yes, 15 or so years ago, 15 years ago, it had leadership at its heart. And in fact, it was a leadership intervention in lots of ways about giving our trainees the chance to come and step up. And people like Hillary, who were around at the time, gave people like me as a sort of ST6 in 2006, the chance to grow as leaders, to go and do leadership based stuff. And so this is really about leadership. So I'm going to talk for about 15 minutes or so, and then I'll put some slides up, and then we'll get rid of the slides, and then we can talk. And it'd be great to hear your thoughts and your ideas and your heckles and all sorts of things. So let's see whether we can get this all fired up in a helpful way. So I'm hoping if I just fiddle around and get it on the big screen, that you should be able to see. Nisha, you're going to give me a wave and a thumbs up. Can you see? Yeah, fantastic. Okay, so the role of kindness in teams. So basically, I want to start with this totally gorgeous photo. So actually, I don't really do very much on Twitter. I sort of dive in and do bits and pieces. But this, I found, I saw this photo come up. I just thought this is one of the greatest photos I've ever seen. And if you go and have a look closely, just look at the faces of this lady. So the lady in the wheelchair is called Margaret, and the chap at the far end is called Richard, and then the care assistant is Adele, who works in a care home, and then the younger guy with his cap back to front is a chap called Joe, who actually works at Ospreys Rugby Club, and he's there on a volunteering program. And I saw this photo and I just thought this is absolutely fantastic. And the amazing power of the internet, and in a way what a small world we live in, is with a little bit of digging, within 24 hours I'd made contact with Sharon, who is she's the manager of the Swinneymore care home in Port Talbot in Wales, which is where this came. We ended up having this complete sort of loving on email and this lovely chat. And I said, I love this photo and I'm doing this stuff around kindness, and I've never, the idea of a picture selling 1,000 words. Can I use it? And she said, yeah, of course. And she told me all about these guys. And basically the story here is that they managed to procure these sea wheelchairs, and a number of the residents said, look, I'd just love to get in the sea and go swimming. I'm thinking, right, how do we get these people? These guys here are 87 and 89. So Margaret's 87 and Richard's 89, and they managed to get hold of these sea wheelchairs. So they go and wheel them out into the sea, and just look at their faces. So care is right at the heart of humanity, is right at the heart of thinking about what really matters to people. So just a starting point. So when you think then also about the sort of future of healthcare services, this from 20 years ago is just worth revisiting. So this is American, and the Institute of Medicine is sort of, I don't know, it's a bit like NICE, it's a bit like the diff groups of Royal Colleges and the GMC all sort of put together. It's the sort of senior medical body in America, and this was written by Don Berwick, who is a absolutely amazing pediatrician, lucky enough to be a sort of somebody I've got to know, and a real sort of huge inspiration. And it was a book actually called Crossing the Quality Chasm. So this is where he and a number of colleagues, a guy called Paul Batalden, also a pediatrician, really sort of drove this idea through around saying, look, we need to think about the quality of healthcare. And so some of you guys who've kept a bit of an eye on policy, the CQC in the years that followed this picked this stuff up. And people like Aradazi, when he was doing, Jonathan will remember well, sort of healthcare for all in London, put quality at the sense. This is about now 15, 16 years ago that Ara did that. But when you think about quality, what we're talking about here is the effectiveness of care. We're talking about making sure it's patient-centered. We're making sure it's timely. We're making sure it's safe, we're making sure it's efficient, and we're making sure it's equitable. And in recent weeks and months, I've been doing a lot of work around vaccine equity and getting into these really extraordinary discussions and conversations. You realize that sort of structural racism really, right at the heart of what's going on in healthcare in this country at the moment. So we've got some really big problems and we've got some challenges, and we've got to think really hard about how we might go about it. So my one little Twitter reference is this sort of little tweet here where and just sort of to be straight, previous to this, I think my sort of record number of likes was either 5 or 6 or something like that. And I was sat in a conference about 2 years ago when conferences were still a thing up in Glasgow. The sort of leading quality improvement conference in the world is something called the International Forum for Quality and Safety in Healthcare. It's run jointly by the IHI and BMJ, and some of you guys may have submitted things to it, and it's a really good conference. If you're interested in healthcare improvement, do have a look at it. International Forum, and you can easy-ish, no, not easy-ish to get posters and things in. Hard to get workshops in, although they're particularly keen on people who can go and do things with patients and stuff like that. So, worth trying to submit stuff. And it's a really, really good conference. So I sat there listening to Don Berwick and Maureen Bixiano talking about a number of things. And then they put this slide up about kindness. And I just put this sort of tweet out that I guess was a reflection that this is stuff that I've been talking about and thinking about for a very long time, but I'd always couched it in a bit of an apology. I'd always said, look, I know it's soft and fluffy, but actually this stuff's really important. And then I just sort of realized it's just absolute nonsense. We've got to change the argument. We've got to argue that this is the business of healthcare. Getting the finances and all that sort of stuff is really important, but that's a tail, that's not a dog. The dog is kindness, is compassion, is empathy. So that's the hard edge, the hard end bit. And I guess recognizing that me as a, white, middle-aged, middle-class pediatrician and I guess growing leader, I've got some voice, I've got some power to be able to stand up and make this point. And, the odd person might listen. And what I found out with this tweet is quite a lot of people were quite mobilized by this stuff. And really this sort of kicked off this conversation for kindness, and I'll tell you a little bit about where that's got to. I want to touch a little bit on theory. So I think having a good theory of change helps. It helps you to ground stuff and land stuff. So I just want to quickly, for the people who think about learning styles, some of you will really like just to activate and go and do stuff. Some of you will be really reflective, or as I'm talking, will be thinking about things that might have happened to you, or you might have done, or it might have happened in a patient conversation. And others might really like the theory. So we're just going to do something for people who like the theory. This book, it's actually got a new version that's just come out this year with a slightly different cover, that is a really good read. It's quite a short book. And John Ballett and Penny Campling, and John Ballett, some of you might have heard talk. He does various bits of, got to know him a little bit over the years. Intelligent Kindness, and it's a definite book to go and dig out and have a little read of. And essentially what they say in here is that if you start at about 9 o'clock on their cycle with kinship, that promotes kindness, which directs an attentiveness and enables people to be tuned in, to empathize with you, which builds trust, and that generates a therapeutic alliance, which leads to better outcomes. So think about a patient or a family who you've got to know really well, and often it's your kindness and your attentiveness that can make the biggest difference in terms of building trust. So when you're thinking here about how you develop as a team within the school, or indeed other teams, you can see how a behavior that is focused around kindness is much more likely to lead to trust and collaboration, might be a better word than therapeutic alliance here in this one, when you're thinking about sort of non-clinical work. So really interesting stuff on this. Lifting it up a level, this is a report that's worth a look as well, that I think is really interesting. So my sort of pretty tough analysis of what's gone on in the NHS over the last 10, 15 years ago could really be summed up by this. So this is somebody called Julia Unwin. So the Scots have done quite a lot on this, and there's a really great organisation called the Carnegie UK Trust, and they have done a number of different reports, and again, people I've got to know quite well. And this came out about 18 months ago, Kindness, Emotions and Human Relationships, Blind Spot and Public Policy. And I've actually got this back on my wall just behind me, and it comes up in conversations loads. So what Julia Unwin says is, we've spent too much time only in this rational lexicon, okay, where we want to try and achieve balanced, fair, safe, and transparent care. So if you think about mid-staffs happened about 15 or so years ago, the response was to really hammer this blue line. Okay, so there was stuff about scrutiny and about making sure we got value for money, loads of stuff about targets. So all of you guys in your healthcare career, we've had a lot of stuff around targets, evidence, data, accountability. And these are all really good things. So I'm not saying these are bad, but some of the risks are that it can all become quite arid and sterile. There's lots of stuff around people gaming targets. We've seen a lot of that, and it reduces trust. And the outcomes are that you sort of spend a whole lot of time in these systems and processes. Jonathan alluded to it in comparing with other schools. So I think a lot of other schools are very much focused only on this blue. What Julia Unwin says is you've got to do both. You need to focus on the rational lexicon, but also the relational lexicon. So the motive here is to create hope, to develop space where there can be individualism and personal change. And the tools we've got around this are a focus on well-being and friendship and spontaneity, discretion, intuition, warmth. This really important bit about storytelling. And I'm very happily, if you aren't sick of me in 25 minutes time on another day, I'd love to come and do something with you around storytelling, because there's some really powerful stuff around that. Now, the criticisms of this is this can be quite a sort of populist response and is a bit qualitative, but actually the outcomes around this are relationships, a trust, and actually a challenge. And my experience of everything that I've ever done that's really been any good, the stuff around setting up the trainee committee will be right up at the top of the list. All the work around connecting care for children, a lot of stuff around leadership development, work I'm doing at Imperial. It's all focused on relationships and trust. That's my single biggest tool to get stuff done. So what about outcomes? What about outcomes for patients? This guy's worth looking up, Len Berry. He works on the East Coast of the States, and he done some really nice research that's really demonstrated that where there is kindness, you can lead to better outcomes for care. And intuitively, we all know that. We all absolutely know and feel that. And he identified these 6 sort of types of kindness or actions around it. This one about deep listening. And I think this one's such an important one. I think all of us can get better at listening. And, you know, I have the disadvantage of being a noisy, fast-thinking extrovert, and that gets in the way of listening. So how do you try and create space to really, really listen? How do you develop your skills in that? I think something, you know, I think about quite a lot, and feel like, you know, I've got a long way to improve on and keep getting better. But the more you focus on it and think about it, the better you can get about it. Empathy, this lovely bit of generous acts of discretionary effort that go beyond what patients and families expect. I know lots of you well enough to know that you do that stuff all the time. There's something really important about that. This bit about timely care that reduces stress and anxiety. So, you know, that quick phone call to a family just to let them know that the ultrasound's normal. Yeah, they're going to get the letter in a week's time that says it's normal, but you just made the effort for 2 minutes. I just wanted to give you the heads up. It's just popped up on my, you know, on my Cerner account. The ultrasound's normal. I thought you'd like to know. That takes 30 seconds. That takes away a week of worry and anxiety. It's a really lovely piece. Gentle honesty. I love that phrase. Gentle honesty in discussions and conversations. Okay, it's the one thing we can do is just be straight with people. Okay, so, you know, I'm sure you've all done that, but, you know, I made a decision very early in my career, sort of when I started, just be straight and honest in every conversation you're in. You know, nobody can ever criticize you for that. And thoughtful support for families and carers. I was introduced to this book, which is a really, really good read. Again, a sort of an American bent on it around compassionomics. So these guys, Stephen Tresiak and Anthony Mazzarelli, or Tony Mazzarelli, have done a lot of sort of hunting out the evidence that shows caring makes a difference, and it's a really, really good read and easy to read. And then the final concept I just want to sort of touch on is this bit about psychological safety. And again, it's a phrase you might have heard about, and I think is very, very key. So I've been a consultant now 11 years, and I worked out relatively early on, maybe took me a few years, that the single biggest job of a consultant doing an attending week is to create psychological safety in the space you're working in. So you go into it like when you're a year 1 consultant, you think, right, okay, gosh, I'm the one who's got to have the knowledge about this and that, and I need to know how long, how many days of antibiotics to put people on, and what the differential diagnosis is, and which metabolic test order, and all of that sort of stuff. And yeah, that is sort of true, but actually what you find out is all the people around you are completely brilliant, and they generally have those answers. So the leadership role is about creating a space that is psychologically safe. And let me explain it a little bit more. So there is a fantastic bit of research that is worth looking up called Project Aristotle, and it was done by Google. And now about 10 years ago, and it was a 2-year piece of work, and they've got lots of money, so they spent proper money on this, and they looked at 180 teams and nearly 40,000 employees, and they basically said what makes a great team, and they did a whole load of interviews and qualitative research and ethnographic stuff, and they found these 5 things that make a great team. And the one in orange at the bottom with a slightly bolder was the most important one by a country mile. But these 5 are the biggest things. So, and the first 4 are dead obvious. So the first one, impact. Team members can see and feel that their work matters and leads to change. So these massively apply to the work you guys are doing in subgroups in the school. So how do we make sure that the work you guys are doing matters and leads to change? And that's a role of the training program directors and Jonathan to create an environment where the work you do does matter. If you did loads of really good work and then it was just ignored, and the leadership in the school just plodded on, the thing we've been successful with the school is the work that the trainees and the training committee have done counts. It drives things, it makes things better. That then leads to work being meaningful, personally important, and I'll come back to this in something else I want to finish on. You've got to have a bit of structure and clarity. So Nisha, here's a good challenge for you here around how do you make sure that team members have clear roles, their work has clear aims and measures and plans. So if people are clear about what they've got to do, then they're much less likely to waste time going down rabbit holes or getting things not quite right. There's a dependability. So there's an expectation here that team members deliver high quality work. And then this piece about psychological safety. Just look at this. Team members feel safe to take risks and to be vulnerable in front of each other. They're being able to say, I don't know. Okay, being able to be uncertain about something. So one of my obsessions, lots of you know me well, about first names. I don't let anybody call me by my surname or Dr. Klaber. No. Look, we're all just people. We're all just human beings. So let's really try and flatten the hierarchy as much as we can. It's interesting because that's hard, because people look at me and look, you're grey and old and you look like you're probably the consultant, so you probably are. So it's quite hard to do that, but important. Okay, last few moments. I want to go on a pitch to you. So you know this story. I'm sure I've told it to some of you guys before, and some of you will have heard it from elsewhere, about 1962, 1963, President Kennedy has gone to visit NASA, and the Americans are spending insane amounts of money to try and put a man on the moon. And Kennedy bumps into a cleaner, the janitor, and he's there with a broom in a long corridor. And, being a good relational president, says, so, what are you doing here? It's pretty obvious he's cleaning the floor. So it was just a polite question. And the janitor looks at him and says, I'm helping put a man on the moon. Okay, so the guy cleaning the corridor is there helping put a man on the moon. And it's just a brilliant story about mission and purpose. So NASA had clearly got everybody so focused. This is the mission. It was 7 years away at that time. And everybody here, whether you're working as an astronaut or the leads of the program or you're the cleaner, you are focused on this mission. And you think, wow, okay, now that's cool. To be fair, the moon is an amazing mission, and it's like you can measure it, i.e. you either get there or you don't, and that's pretty cool. And then you think, hang on a minute, in healthcare, we've got an even better mission. We've got the ultimate mission about caring for people, about humanity, about kindness, about compassion. Yet what we've managed to do, and back to my sort of opener, we've managed to cloud, and we've just got a whole load of nonsense in the